Sir, we all know that the prevalence of coronary artery disease is increasing dramatically. There is a huge burden globally as well as in India. So, what are your thoughts on this increasing burden of coronary artery disease, and to what extent the LDL cholesterol is contributing to this increase in the burden?
Yeah. See, if you look into the coronary artery disease population in our country, there are about 60 million population. This is in 2015, and of this 17% are less than 30 years of age. So we in India have very high incidence of premature coronary artery disease, and there are a number of factors which are responsible for it. One is genetic factor. Asian as such is more prone to have heart problem, and second most important thing is that there is lack of awareness among the population regarding coronary artery disease and those factors which can cause coronary artery disease. So these traditional risk factors are very important if we can educate our population. And Lipid Association has come out with a recommendation that everybody at the age of 20 should have his lipid assessment done. Rather, we have gone a step ahead by telling government, which we plan to be in touch with the government, that you should make lipid screening mandatory at the time of college admission, because you can pick up these youngsters who eventually develop heart disease, and also they can be told about other risk factors like hypertension, smoking, tobacco chewing, diabetes, obesity, physical activity. So all these factors can be explained to them at this particular age, and at this age they can change. Once they get addicted to something, they will not be able to change. So that is very important for it. Now, coming to the LDL cholesterol, LDL cholesterol is, it has now shown very clearly that it is responsible for coronary artery disease. Higher is the LDL cholesterol, higher are the coronary events. And now question is this, that what should we do to this LDL cholesterol? Once you find for example, in youngster high LDL cholesterol, there are many reasons for that, maybe genetic reasons also. Then we have come out with a risk algorithm. It's a simplified way to find out that which youngster or young population requires treatment. But most important treatment in younger population is lifestyle management. That is the key to management of lipid disorder and to prevent coronary artery disease. And we should strictly follow those. It is not that if you just tell them, you have to make sure that they adhere to this disciplined life. That is very important. But we have to be more aggressive in those patients who are at high risk of having heart disease. Now, for example, those who have already had heart attack, they are in very high risk group. And those who are diabetic, as you know that there is an epidemic of diabetes in our country, and probably India is the second country after China to have a maximum number of diabetes. So we have to not only treat diabetes. Most of these diabetic patients just bother about sugar level, but lipid has to be taken into account, and Lipid Association has come up with the targets that those patients with the very high risk group, like those who have heart attack, those who have stroke, those who have peripheral vascular disease, their LDL cholesterol should be less than 50 milligram. And today in my talk I have gone down to 30 to 40 milligram, because this is the level with which we are born. If you just think that what is the level of LDL cholesterol when you are born, it is 40 milligram. So at 30 to 40 milligram there is no deposits. So we can say that safely that 30 to 40 milligram will be a reasonable level for us to have LDL cholesterol, especially in those patients who are very high risk of having heart disease. Yes. So that is extremely important for us to look into it and try to maintain it. The problem which comes in our country is that they will take medicines. Once level comes down, they stop medicine. That is not the answer. You have to continue medicine, especially in a high or very high risk patients lifelong, keeping target of this. You can reduce the dose or increase the dose depending upon what level of LDL cholesterol do you have.
Right, sir. So, sir, if we have a critical look at the recent 2016 ESC guideline, which says that in very high risk patients, the target LDL can be less than 70 milligram per DL, or you can reduce it to less than 50% if it is between 70 to 135. So, obviously, everybody will agree that this is an European guideline, and there are some cultural socio-economic differences between European population and the Indian population. So, it may not be adopted as it is for the Indian patients. and as you rightly said that it can be reduced to less than 50 milligram per dl. So the question remains, is it safe to go beyond 50, 30, 40, or even we can say about 25 ultra LDL levels we can say, and will it be acceptable to the Indian practitioners?
Okay. Now coming to your first question of low LDL, see, there are Mendelian randomized data which we have, in which there are some genetic mutation in LDL receptor which keeps LDL very low in these patients, like loss of function mutation of PCSK9 is one of them, where there are many people who are with LDL cholesterol of 8, 10, 12, 14. They are absolutely healthy, they are fertile, they are mentally sound and all that. So I don't think that level of LDL cholesterol plays any important role in these type of thought myths that it will be it will cause some sexual dysfunction or it will cause some cognitive dysfunction. Absolutely not, because these population have very low level from the birth. If they do not have problems at 40s, having low LDL for 40 years, so keeping LDL lower down at a later age will definitely not be a problem, number one. And second issue is that now we have at least more than many millions patients who have on statin and population all over the world, and we have so far not found out any significant cognitive dysfunction, means brain Alzheimer or dementia. There is not such problem at all. And I think that we should come out from this phobia. Not only phobia of a patient, but from the doctor also. Many doctors are also scared. They are justified also, because they have not seen such a low level in their own practice also. And recently published 4-year trial in which high risk patients, 27,000 patients, 2% of the population had LDL less than 10 milligram, and they did not find any neurocognitive dysfunction, they did not find any increase in hemorrhagic stroke, they did not find any increase in incidence of diabetes. So I don't think that it should be a problem. And in very high risk, this problem should not be thought of. You have to make this man survive, you have to make him live for many years. And I think that benefits are far more than any adverse effect, if it is any, when you bring down LDL to such a low level.
Right, sir. So, sir, when everybody is talking about lower is the better as far as the blood pressure reduction is concerned based on the sprint trial results. So, sir has rightly focused on the benefits of lowering the LDL cholesterol level even below less than 50 milligram per dl and with good safety.